Hello, my name is Kimberly Broussard, and today I will be performing the personal protective equipment skills video. And the first thing that I would do, I will conduct hand hygiene, and I'm using hand sanitizer. Depending on the level of severity of the patient's infectious disease, will determine whether or not you use hand sanitizer versus hand soap. And I have my equipment here. Don't mind my gown. I have been using it to practice. So I have my gown, my mask, and my gloves. So you want to don this equipment on before you enter the patient's room. And the first thing that I'm going to put on is my gown. Now you want to make sure that your gown is fully covering your clothing. And there's 2 straps that you have to tie, with the first being on the neck. Okay, here we go. And the other one being on your waist, around your waist. You want to make sure you get this as far back as possible so that it doesn't get contaminated when it's time to take it off. Okay, you want to pull down, make sure it's snug. Once again, make sure it's not touching anything. Next, I'm gonna place my mask on. So I have my mask here, put it around my ears, pull it down, press the clip in so it's nice and snug around my nose. Next thing I'm gonna do is place my gloves on. So for this, you want to pull your sleeves down so that the gloves go over your cuff. That way nothing will be able to contaminate your skin. And you're going to do the same thing on the other hand. Once again, making sure your cuff is down so nothing will be able to contaminate your skin. Okay, now that all PPE equipment is put on, I will now enter my patient's room. And now I'm done with the exam, so now it's time to remove my PPE. So the first item that gets removed are the gloves. So you're gonna go grab the inside, making sure not to touch the outside because that's contaminated. You're gonna pull out, making sure that you're not touching at all, and then you're going to use the inside of your other finger or your other hand, and you're going to pull out. Let's ball this up first, still not touching anything, and then you're going to dispose in your biohazard trash can, which is with a red liner. Okay, and now the next thing you're going to do is remove your gown. So you're gonna pull the string. It's in the back so it's not contaminated, and then you're gonna touch the inside, not the outside. Just pull down a little bit, and then you're gonna get the outer string that's on your waist. You're gonna pull down. Once again, you're grabbing from the inside, making sure not to touch. Okay, so this is still the inside. Pulling out. And then not touching, the outside is already covered. So I'm balling it up, tossing it in the biohazard, and the final equipment, I'm going to pull off my mask. So I'm going to come behind my ear, once again behind my ear, dispose. And I'm finished taking off my PPE equipment. I'm going to perform hand hygiene as I exit. And I'm going to document my findings and start charting. Thank you.